pharmacies helps communities grow. And let me explain that. Local pharmacies often employ local people, they have local professionals, and they contribute to your community in a more meaningful way. Here at Housers, we do all of those things. We have great staff that comes from our communities. We participate in our communities. We make sure that everybody that wants to has a chance to participate in various clubs or sporting events or sporting teams. And we make sure that we sponsor local community events to have healthier communities. As important as it is for us to provide great quality healthcare at every dispensary counter, we take that philosophy to our corporate level. And what that means is that we want to engage as a business within the chambers of commerce, the BIAs, the downtown core communities that make our towns, our cities, and our communities grow. The patient experience at Housers is a little bit different than you'll find at big box stores or corporate stores. And that's because everybody that works for Housers cares. We want to provide the best level of healthcare. We want to engage in our communities. And when you come into one of our stores, we want you to feel like this is your pharmacy. This is your pharmacy where you get your healthcare. And that's really important to us. So personal healthcare and personal care is a pretty important thing. It's a pretty important thing to me. And the reason it's so important is because I've seen the difference that personal healthcare can make in some of the health outcomes for some of our patients. When we care about our patients, we know that they do better. When we care about our patients, we know that they take their medications properly. We know that they have better health outcomes. Their numbers get better, and they can live a better, fuller life or have a better quality of life. We want to make sure that we can help them in every step of the way. And it's really important for us because we see the difference it makes. We know the difference it makes. We know how complicated the healthcare system can be, and we want that experience to be as painless as possible for a lot of our patients. It's really easy to switch to Housers. We make it easy. We want you, if you've decided to come to Housers, we want to make sure that you have the best experience possible. And that starts from the first step that you take through our doors. So if you decide to switch to Housers, which we hope you do, we want to make that as easy as possible. So switching over to Housers is really simple. All you got to do is pick up the phone, give us a call. You can write in from our website and send us an email, or you can come into one of our stores and tell our pharmacist that you're ready to be a Housers patient. And from there on in, we'll take care of the rest. We make it as easy as we possibly can to switch over. We'll make sure that you get the right medication, that we contact your doctor, that we contact your pharmacist, that you've got all the information you need to be able to interact with us to get your medication whenever you want. There's a lot of reasons you could be frustrated with the current level of care that you're getting at a pharmacy, and we want to make sure that we're able to take care of those reasons. Having a conversation with our pharmacist and explaining where your pain points are, where those issues are that you feel you're not getting the best level of care is something that's important to us because we want to understand you. We want to understand where we can do better and how we can do better for you. So when you come in to us, or if you're experiencing those types of frustrations with your current level of service, we're there to make sure that all of those pain points go away. You know, it's funny when we get new patients that come in to us, they could have been with a pharmacy for 5, 10, 15, 20 years before they realize they're not getting the level of service that they need. So a lot of people that come in to see us, whether they've been with the same pharmacy for 5, 10, or 15 years, are used to getting the same thing all of the time. Well, when you come into Housers, we want to make sure that we're giving you the best. And what that means is sometimes things change. Sometimes we can improve upon things. Sometimes we have a conversation with you that says, maybe we should reevaluate why you're on this medication or not. Maybe we should have a conversation and make sure that you're taking it properly. All of these things are important. And when you're looking at services, it's very easy to do the same thing over and over again, but you're only going to get the same result. If you want better results, then you have to have that change. You have to have those questions being asked. And that's what we do.